Good evening, everyone. Welcome back to You and Your Health. Thank you for tuning in to our program this evening. If you are tuning in for the first time, my name is Erika Roberts, a co-host of this program, and my other co-host is Dr. Edward Isuman. Dr. Eddie, are you there?
Yeah, I'm here.
Hi, Dr. Eddie.
Hi.
Welcome back.
Thank you.
Thank
Thank
you,
you
thank
for
you.
leaving me behind.
I know. You did a fantastic job last week. You had to do double hosting and do all the IT components.
Yeah, and then
Um,
controlling the program at the background as
I
well.
know, I know. I apologize that I had to be away, but you did an awesome, awesome job. And I will suggest you actually moderate more often than I do. So I'm sure our viewers will love to hear your voice more than mine.
Well, I
And,
want to go for the voice training and then come back. And I think that would be perfect.
and you and Dr. Kwashi had a very, very good discussion on dental health and hygiene, and all our aunties tune in and the you tune in. And so I guess those who haven't watched the program, we will definitely suggest that they do so. And
This
hopefully
one.
he'll be coming back
And
soon on
up to
another
now,
topic.
there are a lot of, or there are tons of questions available for him to answer for us. So we will definitely need him to come back to explain further and give us more detail about our oral hygiene and dental care.
Okay. Okay. And we need to thank all our viewers for tuning in weekly to watch our program. This is the 10th segment over the last 3 months. And so we are very grateful for you all tuning in and giving your comments and your suggestions, especially to most of our mothers and our aunties. They're faithful watchers of the program. So I'd like to thank you. And a special shout out, special thank you to our First Lady, Sofomami, for watching and promoting the program. She's always on weekly to watch the program. And our visual act director, Mr. Derek Aintree, for developing our flyers. And our
Yeah.
senior pastor, the very Reverend Moses Aintree. I know I harass you all the time to make sure that you have the information you
Hold
need.
on, harassment is a huge word.
And our mother and our Auntie Jane Inti, for helping coordinate this program. Thank you, thank you, thank you. So, well, tonight, or to evening, I should say, this evening, we have our very own, our sister, Mrs. Mabel Yankee. And I think most of our members know her in her many capacities in the church, but professionally, she's an occupational therapist and a director of a rehabilitation center in Kettering, Maryland, and she'll be discussing the role of occupational therapy in this. But before, Dr. Eddie, we need to say thank you to our last, before we get started, we need to say thank you to our last speaker, Dr. Albert Kwashi, for
No,
his.
wait.
I know. He's one of our own as well. I want to thank him again for his excellent presentation that he gave. So we're going to go ahead and get started this evening. So as I mentioned in our first two programs, You and Your Health is a faith-based health education program, which is centered around the 9 dimensions of wellness, which includes occupational health, physical, emotional, mental, and spirituality as well. So this month, we will focus on the role of occupational health, physical, emotional, and mental and spirituality. The goal is to develop a culturally structured health program that addresses our members' needs in hopes of improving the overall health outcome of our congregation. So, Dr. Eddie, we can get started. Let's say hello to our sister Mabel. Hi,
Hello.
Sister Mabel.
Hello, Sister
Mrs.
Erica.
Yankee.
Hi.
Happy New Year.
New Year to you both, and thank you for having me.
Thank you for accepting our invitation to our program. As we discussed in our private conversation, I think people may not necessarily know what occupational therapy is or what it encompasses, and sometimes difficult to differentiate between occupational health and safety or even social work. So we are grateful that you're able to join us this evening and explain to us the role of occupational therapists and how the relationship between occupation, health, and wellness affect one's health. So before you get started with the presentation, I would like to tell our viewers about your extensive career. So Mrs. Mabel Yankee is a licensed occupational therapist with over 14 years experience as a healthcare provider. Her passion in healthcare started in UK, working as a drug treatment manager in outpatient and within the criminal justice system with those facing addiction and mental illness. Mrs. Yankee holds a Bachelor's of Science degree in psychology and health studies from London South Bank University, where she graduated with honors, coupled with a dual Master's of Science degrees in Drug and Society Policy and Intervention from Middlesex University, UK, and a Master's of Science in Occupational Therapy from the Howard University with advanced certifications in the field of occupational therapy. Her areas of interest, I should say, in occupational therapy include psychiatry, orthopedics, health and wellness, geriatrics, and neurology. Mrs. Yankee is a member of the Occupational Therapy Honor Society, Phi Beta Epsilon, as well as the Howard University Occupational Therapy Honor Society and the Allied Health Honor Society. Mrs. Yankee currently works as a director of rehabilitation in Kettering, Maryland. She's definitely a hard worker. As you all know, she's always doing things for the church. So we are grateful that she was able to take time out of her job, out of other church activities and her family to be with us this evening. So let us welcome back Sister Mabel.
Wow, thank you so much. Thank you so much, Sister Erica. I'm honored to be here. And I just wanted to add that don't forget that our first female Black vice president is a bison too. I just wanted to throw that in there.
Exactly. Those of you who don't know what a bison is, Howard University.
So all my fellow bisons watching this, I just want to tell you, hate you, you know.
That's good. So if you're ready to get started, we can have Dr. Eddie project your slides and then you can move forward. Dr. Eddie, are you ready? You should be coming on soon.
Okay.
He didn't disappear on us.
I'm adding to the stream and then we can keep going.
Okay.
All right.
Okay, so maybe you can get started whenever you are ready.
Wonderful. So hi to all our viewers joining us at home, wherever you are. Thank you for being here this evening. One of the things that I'm absolutely passionate about is whenever I get an opportunity to discuss what occupational therapists do, because there is a lot of confusion, especially when you go to hospitals or any other kind of healthcare center when they talk about, oh, your loved one is going to receive therapy. The first thing that usually comes in everybody's mind is they're going to get physical therapy. They lump OT and speech, they lump us all in one big porridge pot. But we are very different. We all do different things. However, when we all come together as a therapy team, we help provide a wonderful service to our patients out there. So exactly what is occupational therapy? And there's a lot of definitions out there. Just to let you know, Occupational Therapy Association is something that you can always access. You can go online, read more about what we do in your spare time. You could see all the different kind of services we provide to loved ones as well. Just because I know this program is just 1 hour, but for your future, you could always do that as well.
Are you ready for the next slide so Eddie can turn your slide for you? Okay, perfect.
There you go. So when we talk about occupational therapy, we're really looking at the therapeutic use of everyday life activities. We call these things occupation. So occupation for us isn't a job title or a job role that you perform. We're talking about the meaningful occupations that you occupy on a daily basis. So if you think about when you wake up in the morning till the time that you go to bed, all the different activities that you engage in during the day, those are what is called occupations. And we do this, we make it a therapeutic use to help people, whether they're individuals or group, for the main purpose of enhancing or enabling participation in their daily roles, their daily habits and routines in home, school, workplace, community, or any other setting. So OT services are usually provided for habilitation, rehabilitation, and promotion of health and wellness for our patients or clients who may have a disability or non-disability related needs. So disability isn't just a sense of physical disability, just to let you know. It can also talk about emotional, mental, anything that stops you from basically living out these daily occupation. It's seen as a disability. So we treat people across the lifespan. So we aren't just focusing on pediatrics from a young age to geriatrics in your older age. We're treating across the whole lifespan. So from cradle to grave, if you want to think of it in that sense. OT practitioners, again, we work with people of all ages so that we can make sure that they live their life to the fullest. And that is the motto that we have as OTs, is living your life to the fullest. Because we don't believe that life needs to stop just because of an injury, illness, or a disability. We want to promote your we want to make your life enjoyable to live despite your limitations. We want to be able to retrain and teach people to still perform their daily activities, regardless of whatever situations that they find themselves in. One of the things that, and I know you touched on this, Esteriqua, when you were talking about the 8 dimensions of wellness. I love OT so much because we look at the person from a holistic point of view. So we're not just treating the person as whatever illness they're presenting with, but we're looking at the individual, every aspect of the living. What makes you you? What makes you want to function in your everyday life? And we do this through what we call the OT process. So from the time that we have contact with you, the evaluations that we perform, we've got different parts of the evaluations that will look at different client factors, things that are important to you, spirituality, other things that all embody who you are as a patient or as a client that's coming to us. Next slide, please. Okay, so this is basically just repeating what I said. We believe in living your life to the fullest. So again, occupations do not refer to jobs. It doesn't have anything to do with occupational health and safety at work. It's to do with the meaningful activities that you engage in as an individual. We believe in the therapeutic use of these meaningful activities to help you live a more fulfilling life so you can live your life to the fullest. Okay, so on to some boring definitions, but a much needed definitions. So as you all know, the World Health Organization, like the name says, they govern everything that we do in the world to do with our health. They basically define health as a state of complete physical, mental, and social well-being. So it's not just the mere absence of disease or infirmity. And this definition is beautiful because, again, it's looking at the individual from a holistic point of view. It's not just saying that you're only healthy when you don't have a cold or when you haven't been diagnosed with diabetes. Is looking at all these different aspects of what makes you and I a healthy person. Again, they go on to define wellness as also being a state of complete physical, mental, and social well-being. So as we can see, it's linked into health and wellness are going together in terms of the definition that they present in. Another thing that I wanted to point out is, so each year the AOTO likes to give out its vision statement and what we as occupational therapy practitioners want to be focusing on, and new exciting areas depending on what's going on in the world. So as we all know, disease prevention, preventative medicine, it's a very big thing now. It's a very big thing because the government realized that the more you're able to prevent disease, it ultimately costs less to actually treat someone who's been diagnosed with a particular condition. So we want to focus more on preventing any sickness. So the AOTA's main key practice area for the 21st century, one of the areas that was identified was about health and wellness. And the factors that will basically drive and increase the need for wellness related services are based on the accumulating body of scientific evidence that shows that an individual's health is directly related to the physical as well as emotional well-being. So one of the recurring things we're getting from all these definitions is that health and wellness equals to your overall health. It's not just the absence of disease. It's you not having taking good care of your body to start with, and we're going to get a little bit more into that. All this equates to what it means for you to be a healthy individual. So this is a big aspect for we as occupational therapy clinicians. Our aim for the 21st century is this big practice area of health and wellness. The Global Wellness Institute as well, which some of you may also be familiar with, also gives us a definition of wellness. They define wellness as active pursuit of activities choices and lifestyle that lead to a state of holistic health. So this goes in a step further. It actually gives you an idea of the things that involve you being healthy. So it's talking about engagement in meaningful activities, which we OTs like because we believe in the therapeutic use of activity. Talks about lifestyle choices, which we OTs love again because we love health promotion. We want you to make good, healthy choices so you can be healthy. And we also look at an individual from a holistic point of view during our patient evaluations. So, some of the factors that definitely will increase the need for services in this area, we know that we have a big aging population and they live in longer, you know. So the longer that they live in, especially in the setting that I'm working in, we really want to promote health and wellness to them. We want to make sure that they still, even in their old age, they still live in a healthy life. They're adopting healthy lifestyle choices and making healthy decisions too. Because often you find that with a geriatric population, the thinking is, oh, I've lived my life. So what if I'm still smoking? I've done everything that I want to do. Why are you bothering me right now? But if you remember what I said, we work throughout the lifespan. So we don't believe that just because you are an elderly person, being healthy is no longer an option to you. We want to make sure that even in your old age, you are still making healthy choices because being healthy is a commitment. It doesn't just end when you get into your late adult life. Next, please. So wellness and occupational therapy, what is the link? And I think the definitions that we've spoken about already tells us, it tells us the nice relationship that these two have already. So for wellness for OT is basically derived from the concept, as we've discussed, that health and illness are basically inconsistent conditions, both of which may reflect the total condition of an individual at any point in time. So the human body carries a lot of bacteria, as we know, as well as viruses. Most of them are non-cancerous. So until something different suddenly triggers it off, and then suddenly we see a disease emerging in the body. So these cofactors are other things like stress, poor nutrition, physical inactivity. So that means lack of exercise, just sitting at home watching TV 24 hours, or just sleeping all day long and not wanting to engage in anything that helps you, among which we know are related to personal habits and also lifestyle. And I just want to stress the word lifestyle because a lot of lifestyle are choices that we make. So we believe that as OTs, especially with our health promotion component, if you can change a person's attitude, if you can change a person's belief about how perhaps they perceive activity, it can help them actually become healthy. Because these are cognitive behavioral techniques that we use in some of our mental health and psych settings as well. We really believe that attitude, change of attitude can also lead to someone adopting healthier lifestyles.
So I have a question about that.
Go ahead.
So would you say that individuals recognize their own behaviors and become aware of it when you're working with a client, which prompts them to change their um, attitudes or their behavior or their activities? Or do you, as an occupational therapist, have to bring it to their attention to then?
So I would say we do a bit of both,
Yeah.
Sister Valega, in the sense that, again, when we're working with a patient, I'll just use a very typical case. Maybe a patient that we know has poor functional endurance because they've been smoking for so long. And, they're at that point where they would like to reduce the amount of cigarettes they have in a day. So we have an opportunity at that point to let this person see. You will see the benefit for yourself in reducing the amount of cigarettes you're smoking a day if it's going to improve your overall functional endurance. Therefore, you can engage in more meaningful activities. You're not going to have that increased fatigue that you're always dealing with. You're more likely to be active and participate in more activities than what you're engaging in right now. So as you're doing the treatment sessions with that patient, the patient can see that, oh, okay, well, when I was on the TheraX bike about 2 weeks ago, I could only do 10 minutes, but within the last 2 weeks, I've been able to reduce my cigarette smoking from maybe 15 a day to now 6 a day. And now I'm able to actually cycle for 25 minutes. They can see the benefits themselves. So with that evidence base to support what you've been telling that patient, they are more likely to adopt that healthier choice now of reducing their smoking. So, sometimes, as I mentioned, we get, especially in this setting, you do get the patients that it doesn't matter what you tell them. It doesn't matter what the evidence is showing. They've made up their mind. Look, I'm 80. What are you going to tell me? I've done it all. I've done it all. I really don't care about reducing the amount of cigarettes I smoke a day. I just want to live my life and die a happy person. What's left of it, you know? So it's very, very hard sometimes, because that behavioral change is often a process, and they're not willing to participate in that process. But again, it doesn't stop us as therapists to keep stressing to them and keep educating them, to let them know that, you know, your health is really your wealth, as they say. You may have engaged in unhealthy behaviors when you were younger, but now look at the kind of effect it's also had on your health. You've had a triple bypass because of all of this. And then you can try to let them see that perhaps you may not be ready now, but just start thinking about the possibility. Even if you just have a few years left to live, why don't you make that quality years ahead of you?
Yeah. Thank you
Next
for
slide,
answering that.
please. Okay. So again, I know we've mentioned a little bit about the health promotion aspect, but it's important for us to all understand. I know I touched a little bit on it. With the health promotion for we OTs, it comes in so many ways. So it's not just in OT month, which is the month of April, that we kind of stand behind the table and give our flyers to people. No, we do it with every single person that we come across in terms of our evaluation. So that very first contact you have with your patient, where you do a thorough occupational therapy evaluation, you get to see what the problem is, you highlight the deficit. And as you're highlighting the deficit right there, you get presented with an opportunity to do health promotion to them. So we take that opportunity, and we want to help these people that have better increase and control, and also increase the kind of quality activities that they're doing. Because don't forget that we promote the therapeutic use of everyday activity. So the patient's difficulty that they're now presenting with is, I'm not able to dress myself because I can barely even roll out of bed and sit at the edge of the bed. We then speak to that patient like, okay, perhaps this particular life choice that you've made that hasn't been so healthy for you, you may want to look at that as we start your occupational therapy treatment plan. Perhaps you want to reduce your drinking that you're doing. It will give you more energy. You can find other ways to still relax and enjoy yourself. It doesn't have to be always alcohol. It could be something else that you're doing. So presenting alternatives, healthier alternatives to the patient is something that we really want to encourage the patient at every step of the OT process, but mainly in that first contact, so that they also have it in their mind that is part of their overall treatment plan to address some unhealthy habits as well. So to add on to that, so again, the World Health Organization had mentioned that health promotion is not just the responsibility of the health sector, but it goes beyond healthy lifestyles to well-being. And we've discussed that as well. When you talk about health promotion, you definitely just don't want to look at, oh, well, I'm not going to do anything about my lifestyle. I'm going to go to my annual checkup until my PCP tells me my cholesterol is through the roof. And then suddenly I feel overwhelmed because I'm presented with so many things, and I may not want to do it because it just seems too much. We all have a responsibility to ourselves because, as I mentioned on a different forum, what use is it having all these wonderful goals about your life, wanting to do this, to achieve this, when you can't even get out of bed because the lifestyle choices that you're making isn't doing justice to your body. You are living in a state of unhealthiness, and you need to do something about that. So that's something that we need to think on a daily basis, not just when we go to see our PCPs and they bring certain things to our attention. We should master, it's part of self-management. You should be able to master your own health, how you regulate yourself, how the things you put in your body. Is it good for me? Is this bad for me? Is this sugar that I'm eating? Should I really be eating this much sugar? If I am eating this much sugar, is there something wrong with me? Perhaps I need to get it checked out. So these are questions that we need to be asking ourselves on a daily basis. So just to let you all know, the US Department of Health and Human Services had identified the importance of health promotion and disease prevention too. They had the Healthy People 2020 initiative, which identified 4 goals. One was to attain high quality, longer lives. And we're seeing that definitely with our geriatric population. They're living longer because of medicine and also because the lifestyle choices that they've made. They've adopted health younger, so they definitely living longer. They also wanted to see people achieve health equities, eliminate disparities, which we all know being healthcare professional is a big thing. It's definitely a big thing. Let's not be ignorant of the fact that health inequalities doesn't exist. It exists. Things that somebody that has a different zip code has access to may not be somebody's reality in a poor area. It's just the fact that we have to address that. And also, they wanted to bring to the attention our ability to create social and physical environment that will promote good health for all. I think those two, that number two and number three, in a way, are linked because again, if I can't afford, a good place to live, I'm going to be living in the ghetto, and my environment is not really going to be anything that is fostering good health for me. My social surroundings may be anything apart from a healthy surrounding. So these things also go hand in hand with a lot of the socioeconomic inequalities that we witness here in America. And lastly, they wanted to promote quality of life, health development, and healthy behaviors across all lifespan. So this is perfect because it supports and is in parallel with what what we believe that engagement throughout the lifespan, supporting meaningful occupation, promoting good health across all lifespans, and hopefully people will make the right decisions and also master their own lives as well. Therefore, reducing the amount of people that we're seeing day in and day out with the same sickness. It's like a revolving door, the same thing that you see. And you already know that some of these patients that you're seeing coming in and out, so perhaps some of these four areas that are highlighted is what they face in number three. And number two is probably their reality. That's what they're seeing. Hence why you're not seeing any changes in their improvement.
So I have a question. You touched upon OT encompassing all lifespan. And so I'm wondering with the geriatric patients or clients who have chronic pain and, taking pain medicines and things like that, like how does OT help them in developing a program that promotes self-management approach towards performing their activities of daily living? How was that incorporated?
So one of the things that I'm glad you asked that question because chronic pain is a big thing. It's a big factor too as to whether a patient is going to tell you, I'm going to do therapy with you today, or I'm not going to do therapy with you today. The main answer that you usually hear is like, well, why don't you want to do therapy today? I'm having pain or I'm in pain. We can speak to the nurse. The nurse could tell us, oh, we just gave him pain medication like 40 minutes ago. It should have kicked in by now. But then you read their chart, you find out, wow, they've had this chronic pain for actually a very long time. It's something that they're dealing with. So again, during that first stage of the OT process, which is the evaluation and assessment, hopefully this would have come up already. So you have this as one of the goals in your treatment plan for that patient. You may want to reduce if they came in with a pain level of, 8/10. At least by the time that they leave, you want them to reduce that to a realistic 4 or 3/10, And some of the interventions that we provide for that is non-invasive. Let me talk about the non-invasive ones first.
Okay.
So we have things like visualization techniques, which we will tell the patient, try and imagine like a very peaceful surrounding that you find yourself in at this particular time. What do you associate with no pain? What do you think about when you see yourself not having pain? So you offer different scenarios that would almost intentionally distract their thought process on focusing on the pain. So these visualization techniques are there to distract them. And then we also have meditation. We also do meditation. We also do yoga. We also do Tai Chi, occupational therapy. These are some of the emerging areas in health and wellness that OTs are also doing. These all help, especially the Tai Chi and the yoga help greatly with the geriatric population because they found that especially people that are having chronic pain because of joint stiffness, arthritis, these are the things that we see mostly with this kind of geriatric population. So we want to encourage them to engage in activities that promote joint mobility, that reduces overall body stiffness. So the more you're engaging in these activities, the better that pain is being managed. And unfortunately, with a lot of joint issues, the very thing that the joint needs is the very thing that people don't want to do, which is the exercise, which
Yeah.
is the exercise and the movement, because patients will tell you, oh, no, 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 I don't want to do that. It's going to irritate my pain. And then you tell them that, just like with muscle, it has memory. You have to train. You have to train your body to be able to tolerate that. Lack of activity will obviously promote more stiffness. So the more you engage in these activities, it increases that joint mobility and it reduces the stiffness, which leads to the pain that you're probably experiencing. Other
Okay.
techniques that we have for pain management are things that we call physical agent modalities, which is a little bit more involving. Those are things like heat, cold, cryotherapy. We also do acupuncture for those that have the advanced certifications in that. We also do e-stem and ultrasound. That's also another qualification that we have to get as therapists if you want to practice that. And we also do things like ultrasound for those who have a lot of chronic pain in their hands. We do a lot of paraffin baths when they come. We do a lot of contrast baths as well, which is alternating between hot water, cold water, because that also helps to improve your pain. So those are some of the things that we do, both non-invasive and other ones that are a little bit more invasive. Mhm.
Okay. Thank
All
you. Would
right.
you do you also provide, let's say, palliative care as well?
Absolutely,
Okay.
absolutely. We do that. Once again, OTs, we work across the whole lifespan, so from cradle to grave. The palliative care, especially in the skilled nursing or assisted living, wherever the geriatric population can be found that we provide, it tends to focus more on what is meaningful to that patient at that end of life. So
Mhm.
it's not so much as it's a little bit different compared to someone who isn't at the end of life stage. So with that, we're really asking the patient if they're able to verbalize their needs, that is, what would you like to do? They could just say that, well, I would want my room changed in a particular way. Perhaps I want this moved here. So we're looking at the context that the person is in, spending their last few years or
To make
months,
them comfortable.
and then we want to make sure that they're comfortable. I've had the opportunity of doing a lot of home assessments where a patient may say, well, I actually want to move my bedroom downstairs now. I want to be more like interacting with my environment. Being upstairs makes me feel like I'm not part of anything. So bring me to the lower floor. And then they may tell you, I want this flower here. I want this piece of thing here. And what we also do at the end of life stages is we provide a lot of caregiver training for their loved ones that are always around them. So how to handle them, how to move them, how to position them comfortably in a way that they're out of pain or in a way that helps them to breathe better. We may teach them about gentle massages, deep pressure, just so many different things that for that patient at that time is important to them. And then we want to look at, well, the patient still wants to engage in this, but then they have decreased endurance. How can we still let them participate in some of these things without feeling like, oh, it's no use? We still want them to feel like they're still able to do something. So we're
That's very
um,
good to know because
yeah.
typically you would think of end of life care or coordination in
Hmm.
terms of social work, but not necessarily occupational therapy.
Yeah.
So that's very good to know.
Hmm.
Thank
Hmm.
you.
You're welcome. You're welcome. Next slide, please. Okay. So once again, I know we've spoke about the 8 dimensions of wellness, and I'm happy that your program actually focuses on that 8 dimensions of wellness. I think it's
Yeah.
awesome. So with the 8 dimensions of wellness that Solbrick basically talks about, we can see that it's holistic in every sense. When you talk about someone being balanced, these are the things that person should be taken into consideration, and they should be balanced in all those areas, because that is the definition of wellness. It's not just us saying we're just going to focus on just the physical alone, so I'm just going to make sure that I don't have any cold. No, because even with just the physical aspect, it just has so many things tied to it. We want to look at your diet, we want to look at your nutrition, your sleep pattern. Are you resting? What do you do in terms of exercise and other things that are part of this dimension? So even with each of those different 8 dimensions, there are sub-dimensions that we as OTs look when it comes to the intervention that we want to provide to our clients. So usually at that first contact, that is during the evaluation and assessment, we want to ask them, like, what are your hobbies? What are the things that you like to engage in? Do you have something that you do on a weekly basis that you're committed to that now you're not able to? So this is after we've gotten the main occupations that they engage in, their ADLs, their activities of daily living. Down. And we have another section too, which talks about something called instrumental activities of daily living. So the instrumental activities of daily living isn't the basic bathing, dressing, eating, sleeping, and being able to feed yourself. Those are looking at other things like grocery shopping, money management, other things that involves like social aspects to it, I don't know, being able to drive a car, transportation, mobility. These are all the things that encompasses instrumental activities of daily living. Perhaps you have another role. You're not just a mother. You're a grandmother too. You play other family roles. You're a caregiver. There's so many things that are involved in that. So when we're doing that evaluation, we're looking at if any of these IADLs, if you have a breakdown in them, how is that impacting your wellness? So it could be an environmental issue. It could be something that the environment is impacted. Perhaps they've been relocated because of a flood or something. They're not able to do the things that they were doing before because they were maybe working in their basement. That was their office. But now they find themselves in a shelter and they don't know what to do because now their income, their financial wellness aspect too, has also been impacted. So there's all these different things. So we occupational therapists will look at that because we wanted everything that we do, the goals that we set is all client centered, is client driven. So it's not me telling you, oh, I think you need to lose 10 pounds. That's your goal for being here. No, the actual patient or client needs to tell us that, look, you're my therapist. This is my goal. So we have something in our OT treatment session which says, what is the patient's goal? Number one, people always say, I want to return back to my prior level of function. So if I was somebody that was completely independent in everything that I was doing, and suddenly I've been impacted by this huge depression, I don't even want to say physical disability because we always think physical, but we deal with a lot of emotional and mental disabilities now that people don't see. It's not the obvious one. It's like a hidden disability almost. You don't see it outwards. You don't see that someone that's going through depression has lost their arm or their leg and may need prosthesis. That's even worse. Those are difficult to even treat. So if the person is telling you, I want to be able to go back to being that fun-loving person where I was always around my friends, I was engaging in things, I had hobbies, and now I have nothing. I'm not engaging in any meaningful activities. My life is just this huge balloon of darkness that I'm in. So you get to hear those kind of things more in a psych setting as an OT. And what you want to do is you want to structure an occupational therapy treatment plan that is addressing all these different wellness dimensions that are coming out of the evaluation, are coming out of the deficits that you're picking up from your patient as you're doing that evaluation. This is the reason why for we OTs, evaluation isn't so much robotic like checklist. Yes, we have our format, but we want to make it conversational. We want to make it more client-centered. We want the patient to feel very relaxed so they can really tell you what their ultimate achievement for coming to OT is. What do they really want to get out? Because often when people are on edge and they're not relaxed and they're not themselves, you're not actually going to get a true picture. You're not going to get a true picture. You get a kind of skewed, plan of care that you're hoping that the patient will be okay in the end, only for you to get to almost like 2 or 3 weeks before discharge. And then suddenly the social workers coming to tell you, oh, Mr. So-and-so, I heard yesterday that he tried to kill himself. And you're like, what? How did that happen? He was doing so great in therapy. I can't tell you the amount of times we say that. How did he fall? He was doing so great in therapy. That's all we hear in the morning clinical meetings. Therapy. I thought you guys said this guy could walk. Why is he falling?
So I have a question. Do you, and I know that your current setting is a rehab facility and therefore is inpatient, But typically, if someone, a client who's outpatient, wants to seek OT therapy, would they be able to obtain those services?
Absolutely.
Outpatient, okay. Because
Absolutely.
I asked that because obviously, one's environment affect their overall well-being, and the challenges in our work life. We spend a lot of time at work, right? So the challenges in our work life can impact our health and our well-being as well. And so I was wondering whether OT take into account how interprofessional collaboration can impact one's health and their quality of life as well, particularly, outpatient, not necessarily inpatient.
Okay, so you're basically asking if the different disciplines interact and helps people that come to outpatient. Yeah.
Yes.
Yeah, definitely it does. It does because I think one of the good things that we as healthcare professionals fail to even realize sometimes is it doesn't always have to feel like you're the only one. We have other disciplines. Perhaps you don't really need OT. Maybe what you need to do is you need to see a psychiatrist rather. Yes, I may be able to help you in the mental health aspect, but perhaps what you're presenting with is something that may need medication. There's no harm you getting OT, but in addition to something else, you could do better. So we have to be able to recognize that. And I'll give you an example. In an outpatient setting, you can have access to OT, PT, and speech. Your doctor, all you need is just a referral. And I hear that even in some states, such as California, you don't need a referral. You could actually just go and see a PT. I'm not sure about the OT yet, but I know that for PTs, you could definitely just walk in into an outpatient and you can get treated for that. One of the things, once again, when we're doing evaluations in whatever setting, you have to be able to listen. Active listening is very, very important. So this is why I say the OT process, that first process of evaluation shouldn't be robotic. You should be having a conversation. It should be the getting to know, the establishing of the therapist and patient relationship. That's what you should be focusing on. So if you're hearing your patient make the statement like, oh, things got so bad last month that I actually thought about taking my life. That shouldn't be you saying, "Oh, is that right? Okay." That should just let you stop what you're doing right away and kind of find out more into it. Now, depending on what setting you're in, just to let you know how serious we take emotional well-being. OTs also perform another assessment here in addition to the evaluation that we do called a PHQ-9 scale. And some of the healthcare practitioners may be familiar with that scale. It's a depression scale and it measures depression. So the whole aim is you do it together with your evaluation. You talk more. So no one needs to tell you when you're doing the patient's chart review, you see that the patient is on an antidepressant. You obviously know that this patient has been diagnosed with depression in the past. So your focus as a clinician, you shouldn't go in wanting to know, well, are you still feeling depressed? They're clearly still on the medication. They haven't gotten off yet. So you need to have that kind of clinical reasoning where you can ask that patient at that particular time, how are you progressing in managing your depression symptoms? How is it going for you? Do you think that the medication that you're on is helping your symptoms? And if not, you have to let that patient know that, okay, now that you've reported this to me, and because we care about your overall well-being, I'm going to let the social worker know so she can put in a side consult for you. Okay. So that's the kind of approach that we take. We definitely recognize that there's a lot of other professionals that are in play when it comes to us providing quality of care. It's not just PT, OT, and speech. There's the other disciplines we work hand in hand with, the social worker, the geriatric psychiatrist. If it's an outpatient setting, all those three disciplines, plus the psychiatrist who may be coming in maybe twice a week, depending on whatever referrals that he's had. But we really want to recognize the things that patients are saying and, seek the help of other disciplines too, who may be in a position to provide better treatment for them.
So how would you incorporate spirituality into the client's care?
Okay. So for we occupational therapists, spirituality was actually added to our OT framework, which is our scope of practice that we work in. It was added in 2008, I believe, and is seen as a client factor. So since it's a client factor, that means it's something that we are going to discuss with our patient as we're doing the evaluation. So if you, Eric, while you're telling me at the time of evaluation that, oh, I'm a Christian and, praying is very, very important for me, because research definitely shows that spirituality, healing, and disease prevention is linked. It's part of the whole that wellness dimension is very, very important. Most people who have a belief in something higher than themselves tend to do better when it comes to managing their disease, their condition. They feel like they have an outlet. They feel like they are not dealing with things by themselves. And they're actually seen as more likely to recover because they're praying more to their God. They're believing for healing. They're trusting for healing. And this is part and core of who they are. It's part of the identity, how they identify themselves. And also, most importantly, that prayer that they're telling you they engage in, that's a meaningful occupation to them. That's something that they do. So you definitely want to recognize that and add that to their plan of care, that you as a therapist recognize that that is a very important client factor for them. And therefore, you've included it in their plan of care, all part of the holistic approach that we like to take in the terms of providing a plan of care that addresses the patient's every need.
Yeah, I think based on our discussion, it sounds as if for children in particular, that occupational therapy services are services that can help them gain independence, right? So not necessarily social work, or obviously not physical therapy, and I'm not even sure what other disciplines besides counseling will help them. So in terms of children, I read something about sensory social groups, how the therapists use sensory social groups to help pediatric patients gain independence. Do you mind sharing a little bit about that? I'm not quite sure
Sure.
what services that provides.
Okay, so most children who have sensory processing disorders, and I'm really happy that we're actually talking about sensory processing disorders, especially for the pediatric population. I say that because we, as people of color, put it that way, and especially people who have our heritage and roots in Africa, there's a lot of things when it comes to childhood development that we like to brush under the carpet because we don't want our child to be labeled. But early prevention, early intervention for children, it's very, very, very important. Like, I can't stress it with the number of varies to add to that sentence, but it's extremely important because the earlier you seek early intervention from any child who may be having sensory processing disorder, or who may be autistic, or who may have other things going on the spectrum, the better for that child to be included in a regular class, if you like to call it that way, or to be included in a class that doesn't have any children who present with any kind of spectrum disorders. Sensory processing disorder mainly see it in children manifesting, and kids see them, kids that are growing up, sometimes they don't like the feel of a particular fabric. They don't want to put on this particular clothes. The way it feels on their skin is makes them feel kind of way. They don't like people touching them. They're very sensitive to certain things, or they don't want to be in a place where there's too much noise. They get very upset, or they see too much bright lights. They have a complete meltdown, or they find themselves in a situation that is overstimulating them. So what occupational therapists and a lot of treatments out there will tell you that for most of the treatment for kids who have sensory processing disorders, let them see a physical occupational therapist. PTs don't even think about stealing that from us. But the main way that we work with kids with sensory processing disorder is it depends. So we have kids who are sensitive to too much stimulation. Okay. So for them, they need to be having interventions that regulate, or whether too much stimulation or too little stimulation, both need to be regulated, put it that way. So for a child who likes getting a lot of stimulation, you want to make sure that the treatment interventions that you're providing for that child, jumping in a big ball, balloons and all of that, swinging, the kind of the sensory diet for them is basically their plan of care. We call them sensory diets. So for the child who is overly stimulated, easily stimulated, you want to look at how you can regulate that. Perhaps put in interventions where They are not easily triggered when they get a particular sensation of someone touching them. They don't kind of start pulling away or start screaming because it makes them feel so uncomfortable. So we use different equipment. We have, if you ever go to a sensory lab, we have, it's like a room that has different sensory objects. So we've got ones to kind of regulate the person who easily gets stimulated. So you see is more softer, is more gentle. The lights are dim over there. You kind of see the kind of light you would see on a roof, maybe stars, something to soothe them, because the whole thing is about soothing, because they're easily, stimulated. So you want to regulate that by different soothing interventions. We also have kids that perhaps they need more stimulation. So when you go to that kind of gym, you're going to see a lot of swinging. You're going to see a lot of big balls, tiny balls that they can throw around. It's often a padded room as well. They can jump, bump themselves here, do that, do that. So they believe that coupled with activity, physical activity, helps to regulate some of these sensory processing disorders that we see in kids. So the type of sensory diet that child is put on, ultimately we do see results. And I have to say that, the jury is still out there. Scientists are still trying to figure out, this, the kind of interventions that OT provide for kids with sensory processing disorders, is it really working? I say they keep referring them to us. So there's something that we're definitely doing
I'm
right.
sure somebody's doing research on that. That would be good information to know.
Absolutely.
Okay, thank you.
You're welcome.
Okay, I'm not going to interrupt again.
Okay, we can skip this because we spoke about that. And the only thing I wanted to mention, especially with this slide, is just remember that it's not as simple as, oh, I'll just take financial satisfaction with your current and future financial situation. It has a lot of interlinked things. So my financial may be dependent on my social. It could also be dependent on my environment. So we like to remember these things as OTs, especially when it pertains to health and wellness, that it's not so simple for someone. Working in a psych unit, if a person's aim is, I want to be able to find a good job, definitely finding a good job, that's occupational satisfaction, is going to improve that dimension of financial wellness for them. It may even impact the environmental wellness. So we believe that it's interlinked. These dimensions of wellness is interlinked, just like the holistic approach that we provide to our patients. We believe that one thing will affect the other. That is the reason why when we are doing our evaluations, we want to look completely at everything that this patient is telling us. How is this impacting you? How is this, helping you or limiting you? Because at the end of the day, if the patient is ready to go home from rehab and suddenly they're saying that there's nobody at home with me, I can't cope, I think I need some help when I go home, how are they going to be able to do that? So that's something that is going to affect them, the environment. They don't have the support. They don't have a network of loved ones who may need them. Yes, that patient may be going home with independence and everything they do, but they may need intermittent supervision for safety reasons or another. If we're not able to identify someone that's going to help that patient do that, it's going to definitely be something that may impact what we may consider a safe discharge for that patient. Next slide, please. Okay. So these are just some of the different ways we OTs work in the area of health promotion. So you've all heard of workplace injury and prevention. We do something called work hardness as well. So most of the people that do have injuries will come to OT and PT to get strength, mainly the factory workers who may use a particular machine. So before they could go back to work, the employer may want to say, are they able to now lift 40 pounds? Because that's a requirement of their job. While they're in therapy, part of their treatment plan is thera exercises. And some of these thera exercises may include being able to handle a lot of weight up until they get to that required weight of 40 pounds that is needed for them to get to work. We also like to go into workplaces, corporate offices, and talk about employee wellness programs, which is one of my favorite things as well I like to talk about, because there's so many ways to promote employee wellness, especially during this time of COVID when healthcare workers are absolutely burned out in every area. We need to really think about our own health and wellness. So one of the ideas that I was discussing here with our administrator just before Christmas was, why don't we in the spring we can actually invite, I can have some of the therapists do it. We can provide like a 5-minute therapeutic massage to all our workers during lunch break. And then we can change that during the evening shift, afternoon shift, when the nurses change, we offer all of that. These are things that help. Just that 5 minutes of not doing anything, entering a room where some peaceful music is being played and just being given a nice therapeutic massage. That it just makes a person feel good. It makes them feel like they are valued by the employer, you know. So these are some of the things that we like to also promote in the workplace, for employers to kind of bear in mind. And definitely, research shows that employers that have a good wellness program are more likely to have workers that want to stay, who don't quit, who are very committed, less call out, less sick days, the whole thing. So the more you invest in your workers, they give you good return back. We also provide ergonomic assessments as well. This is also another specialized assessments that OTs do. We go into offices or we go to workplaces. We look at what we call workplace redesign. How can we design this person's workstation so they can stop complaining about wrist pain or eye strain or shoulder pain or perhaps pain with their trunk because they're constantly moving from this side to that side, even though things are not in the right place, they need to be, hence the reason why they're having that pain. So that's one of the areas that we also work, because we want to decrease all this unnecessary repetitive motion that we subconsciously do without even realizing. And hopefully we want to do it before it gets to a point where someone is calling out sick because now they have chronic back pain because of poor seating, their height of their chair is not properly adjusted, the dimension of their eye is not in parallel with their laptop, so on and so forth. So that's one of the things that OTs we do as well.
Those workstations are very expensive, so most companies will not approve it without having that assessment done and signed.
Yeah. Again, usually when we do the wellness programs, go into the corporate offices and discuss it with the workers, we let them know that, you know, this is something that is expensive. But if you think about the long-term savings that you would have provided to your company because somebody hasn't called us, someone isn't suing you for something, and you know you have an efficient workforce, it doesn't need to get to the point, as I mentioned earlier, where somebody is complaining that, well, I've worked for 5 years sitting in this same position, this same chair. I've been telling you that my back, and nothing was done about it. Often, once we do our evaluations with the ergonomic assessments, if we identify, because these are trained occupational therapists, so we know our anatomy and physiology very well. If we identify a serious anatomical problem with that, we will let them go see their primary care physician to get a slip, maybe for further assessment. And then from there, with that support of the slip and the recommendations for new software and new chair and new desk space, the company honestly cannot deny that. Okay. Sorry, my Siri picked up my voice. Okay. One of the other things too that occupational therapy practitioners we like to look at is basically the person's areas of function to support optimal health. So what are the functions that the person plays? You know, what are the key roles that you're playing in your life? Because it could be that they are very demanding on you. It's taken a toll, you haven't really assessed that yet. So again, this goes back to that balance, that wellness balance. So yes, you may be a very busy person, but what time do you take for rest and sleep? You can't work 16 hours and only sleep for 4 hours. It doesn't work that way. The same expectation that you would have for your car is exactly what you should also be expecting for your body. You even park your car, it rests, it sleeps, but then you don't do the same for yourself. You take your car for oil changes, but then you can't even remember the last time you went for your annual. So these are some of the things that we definitely want to make sure that all aspects of a person's life and areas of function is to support optimum health.
Let me ask Dr. Eddie whether we have any questions for you besides me asking the questions because of time. Dr.
Yes.
Eddie, do you have any questions for Sister Mabel?
You guys are having a fantastic conversation.
Do you have any questions for her, or she should go ahead?
I think she should go ahead and
Okay.
then maybe at the end.
Okay.
How many slides do I have left, please, Eddie?
Just two. One is a reference slide, and the other one
Oh,
is.
so we just have one.
Yeah.
That's awesome. That's good for time then. That's
Yeah.
good. Okay.
Okay.
So thank you. Thank you, Eddie. All right. So the last thing that I wanted to just basically summarize. I think by now at least you would have a basic understanding of what OTs
Yes.
do. So we don't help you find a job. However, even though I say that, however, if you find an OT who's working in like an outpatient setting or who works in a drug and alcohol detox unit, these are some of the things that the OTs there will do. So it depends on what setting. But when you hear occupational therapist, it's not someone that helps you to find work. No. The occupation that we're talking about is the meaningful activities that you engage in on a day in and day out basis. So just remember, my dear viewers that are listening to us, the path to health and well-being is linked. Is linked to participating in daily occupations. Okay, occupational therapy practitioners like myself, we want to look at you in every area of your functional, anything that you do, anything that you deem as important. We also see that as playing a role in you living up to an optimum health and having that top-notch health that we want you to do. So it's not just the absence of a disease, it's the other factors in that wellness dimension that play a role in helping you to achieve your overall health and wellness. Okay. And we always believe in promoting a client-centered approach for you to be able to perform these daily occupations or therapeutic activities and also helping in the adoption of healthy habits. Because really, we're as healthy as the lifestyle choices we make. We are as healthy
That's
as,
right.
yes. So the healthy habits and the routines, these are the things that occupational therapy practitioners, we want to make sure we facilitate health across the whole lifespan. And these healthy choices should be done throughout the whole lifespan. So as I mentioned earlier, not it doesn't stop just because we even now as an elderly person, we have young elderly, middle-aged elderly, and then we have old elderly. So there's even different levels of geriatric population now. And lastly, I just want to say that OTs, we love to focus on enabling our patients or our client to maximize their capacity to participate in life activities that are important and meaningful to promoting your overall health and wellness. So it's not about us, it's always about you and what you see as important in living your life to the fullest. Thank you.
Thank you, thank you, thank you, Mr. Mabel. This has been an excellent, excellent presentation. Dr. Eddie, I just want to make sure we don't have any questions lingering before we let Mr. Mabel go. Or do you have questions yourself?
Do
Just
I
in
have
case you
questions?
do.
I heard that you mentioned earlier that he likes sleeping, and I think I did touch on I did mention, I said, you definitely want to engage in good activity. So rest is good. It's part of the physical
So,
dimension, but don't do too much of it. We need you to be active,
all
like
right.
exercise and workout. That's good too.
Yeah.
Okay. So my question was, we are being asked not to live a sedentary lives, but in this COVID times, it looks like most of our things have been working from home and
Mhm.
watching the TVs and watching your computer screen and doing everything behind your computer, sitting all day. I mean, those times, I thought work was boring, but I realized that it's good to see people around, chat with people, go for a walk, go for a coffee. So, I mean, all that is happening. What do you think? What advice do you have to give with
Okay.
all that is happening here?
So I think the good thing is at least some of the gyms are now open. If you're brave enough to enter that environment, is good for you. If not, do what I do: set up your gym in your basement, have a routine. And I mentioned this on another show that we have on Facebook as well. What I say is start small because for a lot of us, trying to come out of the sedentary lifestyle is probably new. We were never active people anyway. So how can I still make sure that I am being healthy? I am promoting and taking charge of my own health. Well, why don't you just start small? Because when we start small, it's more achievable. It's more achievable. So you don't need to run the treadmill for 1 hour. No one's going to give you a medal for that anyway. So why don't you do it like 15 minutes or 10 minutes? Or just go for a brisk walk at nighttime. Just go for a quick walk and come back. your heart will thank you for that. And while you're making these small adjustments as well, be mindful with your diet, because there's no point doing all these exercises if you're still going to have fried chicken every night. It's not going to help you. It really is not going to help you.
Hope you're not going to talk about our kinky and
He's
What did
always
you
eating
say, Dr.
kinky.
Eddie?
Eddie's always eating kinky, by the way. You ask him,
Okay.
how are you? And he goes, I ate my kinkies.
yeah, my kinky
Well, I
never
think whether it's 10K or fried chicken, we don't want our diet to be one-sided. We want our diet to be a colorful plate. We see some greens, we see some yellows, we see some reds. We want a nice variety of color because obviously eating too much. Dr. Eddie, I don't even need to preach to you about eating. You're a doctor. You should know. Well, you should know. But you know what they say? Health workers are the worst people to do health promotion with. You see your doctor outside there smoking. You put you in.
That is
smoking,
true.
abusing medication.
Yeah,
Oh,
yeah,
Lord.
yeah, absolutely. But at least with the medication thing, it's really being regulated now. Anytime you prescribe a narcotic, I think your name gets flagged. So they are watching
Yeah.
people on that. But definitely from what Dr. Eddie said, I will advise our viewers start small because if you start too big, it's not realistic. You're not likely to stick to it. You start small, you know that you may say, okay, well, I like my meat, but perhaps just 2 days a week, I will eat fish instead. I won't eat meat all the time. Or perhaps I'm not going to eat kenke 5 times in a week. I will have a different option. I'll have quinoa and I'll have kenke on Fridays and Saturdays as a reward to myself for working hard. So you want to alternate. You definitely want to.
Alternate between the quinoa and your wache or your jollof. Anyway,
Yeah.
Oh,
well, thank you so much, Mabel. I
yes.
think based on the
Yeah.
comment, our viewers and members of our church gain a lot of information
Awesome.
regarding this discussion and now have a better understanding of what occupational health encompasses, especially on how health, environment, occupational performance have a whole dynamic influences on quality of life and wellness. So
Absolutely.
we certainly appreciate you coming on our
Thank you.
program.
Thank
And
you.
we
Thank
hope
you
that
for
you come
having me.
on soon.
Yeah.
We
Looking
hope
forward
you
to
come
see
on
you
soon.
again.
Say it again, Eddie.
So looking forward to see her again.
Yes, we look forward to seeing you
Oh,
very,
sorry, I
very soon.
didn't catch that. Are you guys asking me to come back again?
Of course. We asked, well,
Oh,
yeah.
But we finished the slides.
Well, you're gonna have to develop another one about another topic. Maybe a core performance of something that you
Oh, I
do
think
for
someone asked a question about what
um,
about Tai Chi and dancing? Absolutely. Dancing of any type is good because we want your body to be moving. I'm not saying that, you've never done before, start breakdancing. Obviously, you need to apply a level of reality to it. So just anything that encourages joint movement, joint mobility you want to do. And I mentioned earlier that Tai Chi and yoga is very good for the geriatric population because it's a gentle kind of movement, but you're still stretching. So it doesn't require a lot of energy expenditure. You can stop at any time, you can restart at any time. So you definitely want to engage in those kind of age appropriate exercises. Obviously, for those who haven't exercised at all, I would say that please consult your physician, especially if you have a cardiac issue. Don't just get into it. Consult your physician and speak to your physician about what types of activity you can engage in.
all right.
okay. Well, thank you. Thank you again. And thank
Thank
you for
you.
staying at work to do this with us. We
This is a
truly, truly
normal time. I'm
appreciate it.
usually here at this time. So
Thank you.
thank you for having me, guys. Thank
Likewise.
you.
Well, have a wonderful evening and we look forward to
Likewise.
having you soon.
Mm.
Okay.
Guys.
Have a good
All
evening.
Have a
right.
great
Thank
Bye-bye.
one.
you.
Bye-bye.
Bye. So, family, we hope this segment was informative as usual to you and your family. As always, please share the link with others so they too may benefit from our discussion. So, Dr. Eddie and I will be back next week with our new guest, Mr. Michael Martin. I'm sure most of you viewers from at least from our church know him, and he will be discussing fitness during the pandemic. As I indicated, this month is dedicated to wellness and health and wellness and spirituality and mental well-being. And so we'll also have another segment on acupuncture. And then next month in March, we'll have a segment on mental health as well. So we look forward to you joining and tuning into the program. And if you have questions, please feel free to forward the questions to emcuandyourhealth@gmail.com. Again, that's emcuandyourhealth@gmail.com. We are waiting for questions. We do not get a lot of questions in our email inbox. So please do forward your comments, questions, and suggestions so we can make sure that the program is productive for you all as viewers. Please also remember to stay safe. We are still in a pandemic. Make sure you wear your mask, wash your hands, and social distance. And so we look forward to seeing you on the 16th with Mr. Martin. Have a wonderful evening. Thank you. Bye-bye.